straight into it. What is an opinion piece? Excuse me. The name, the answer is right in the name, right? An opinion piece is a piece of writing that you write that expresses your viewpoints on any topic, any particular subject, right? And they come with various names. Typically you'll see opinion, but sometimes you'll see op-ed, sometimes you'll see editorial, sometimes you'll see guest essays, letters to the editors. These are all varying flavors of opinion pieces. The most popular one will be op-ed, right? And op-ed, most people, when you hear the word op-ed, most people think that it actually means opinion editorial, but that's not exactly correct. It means opposite the editorial. And the reason why it's called opposite the editorial is because typically in a newspaper, an editorial is an opinion piece that is published by the editorial board of that newspaper. And usually in a printed newspaper, it's on one page. And right opposite it, they give the page to any member of the community to write an opinion piece about the any relevant news articles, right? So op-ed, hence opposite the editorial. So here we'll use the word op-ed throughout the piece because that tends to be the most popular. Some articles, some newspapers like New York Times, they now use guest essays, which is also becoming popular. Opinion pieces can be solicited or unsolicited. So sometimes you can have an outlet or a newspaper reaching out to you to say, you're an expert in this field. What do you think about this current news article, right? But most of the time they're unsolicited. You have an idea, you reach out to a newspaper and you pitch to them and they publish your piece unsolicited. So these are just some random examples of opinion pieces, op-eds that have been published over the past couple of years. And just to show you that they can cover a wide variety of topics, right? The one at the top is by the former director of the Africa CDC, John Kengasong. Africa's low vaccination rates should concern everyone, right? He's calling for, the distribution of vaccines, vaccine equity in Africa. The one at the bottom left is by President Obama, right? So politicians write op-eds quite a lot. The one in the middle, lower middle, is the one that was published recently in Al Jazeera, and that's on a very hot topic right now, the Barbie movie that just came out. If you Google, you'll see lots of opinion pieces about the Barbie movie. So you can write on current pop culture. Again, this is another one that was published in African Arguments, right, about Afrobeats. Afrobeats is growing. What next? What's the next chapter for Afrobeats? And the one at the top right is by President Paul Kagame in Rwanda. Opinion pieces can be published in newspapers, and generally they're published in newspapers. But for those of you who are academics, they can also be published in academic journals. So these are some examples of opinion pieces that are published in academic journals, and typically they're called editorials in academic journals. So you'll see these are some that have been published in the Lancet, in BMJ Global Health, and other outlets. This particular webinar will focus on opinion pieces that are published in general outlets, newspapers, online platforms. But at the end, we'll have one slide that will talk a little bit about how do you write these types of articles for academic journals. So just some examples from our work, right? Some examples of editorials that we have published and the impact they've had. This is the first opinion piece that Ulrick and I published together back in 2019. It was published in Devex. And the opinion, clearly is called, "It's Time for African Leaders to Invest in Surgery." This opinion piece came about after my cousin had a terrible road accident in Cameroon, where I'm from, and he really struggled to get access to a facility where he could get his surgery, and he had to be flown out of the northern region where he was, and this was very devastating to experience, right? And Ulrick and I, being people who work in this field of surgery, decided that we would use that opportunity to draw attention to the devastating consequences of poor surgical care in Cameroon and Africa in general. So this piece, we use that personal experience to draw attention to an issue that we are particularly interested in. I'll hand over to Ulrick to, excuse me, to talk about his piece that he published in BMJ Opinion.
Thank you so much, Des. Thanks everyone for joining us. So, like we mentioned, there is a need to share one's opinion when there's a feeling that what we're passionate about does not get as much attention as it should. And when it comes to some of the things that we care about, in my instance, back in 2019, I was on the point of joining a program at Harvard Medical School. And just before that, I had the chance to be invited to the World Health Assembly. This was an unsponsored invitation, but it's always a great experience. You're going to be in Geneva with some of the biggest names in global health, in health in general, health diplomacy. So it's an amazing opportunity. I went to my local Swiss embassy to apply for a visa. Before doing that, I had to obviously book a flight, get accommodation, spend quite some money, get insurance, all those things. And then I did apply. The response following my application came the day before I was scheduled to travel. And the response was a rejection. And following that, obviously, the first impact was the financial impact of just having to lose all that money for the flight and accommodation and all that, but also the missed opportunity, I would say, to participate in a big event and be able to contribute to the conversations that were held in Geneva. And that really affected me. So I shared my story initially on social media, and I found out that there are a lot of people that had gone through this, where especially when you're starting off in your career, it's not uncommon in international development, not just global health. When you're going to a conference, it's not common to get a visa rejected. So that led to the very first piece, which is the one that was published in the British Medical Journal blog. And then following that, there was some traction behind it. Madukapai out of McGill University wrote a piece in Forbes, and more traction led to the London School of Economics inviting me as well as other people to an event to discuss this issue, because they themselves had a few issues where they'd invited a number of people to a conference and most of them could not attend. And you would probably guess right that most of them were from low and middle income countries. So then there was more recently the largest AIDS conference on earth, really organized in Canada. And there was an entire panel that could not attend, again, because they were denied a visa. And there was this image that circulated on the internet showing how everyone was waiting for them to come and share their knowledge, their experiences, but they were not there to attend. Yet there was a minister from the Canadian government attending the conference. And this led to the NPR, National Public Radio, to pick up the story again and interview us. And we had those conversations. So after having all these conversations initially, there were always questions of how much are we losing? What is the impact of all of this? That's when we then use our experience and then our academic experience to come up with a final article, which was published in BMJ Global Health, about the impact of this issue. Because initially when we started speaking about it, for a few people, mostly from high-income countries, it didn't seem like it was so widespread. But for those from low and middle-income countries, it was just pervasive. Everybody knew about it. And so bringing some data to that conversation definitely helps you. And later on, when we speak about what elements go into a good op-ed, we'll see why this is important.
Thank you, Ulrick. So another clear example of how your own personal experience led you to share about your visa denial and also reach broader audiences, right? And we'll have a number of similar discussions later on. I'd like to give an example of a non-traditional op-ed that I wrote. So there's a formula. We'll give you a formula for op-eds, and we encourage you to follow this formula. But op-ed is partly science, partly art. So the formula is kind of like the science part of it, but the art part of it, you still need to be creative, right? So sometimes you may be completely artistic and follow a different some way to captivate your audience. So this is an example of an op-ed that I wrote, and it's an editorial in an academic journal, BMJ Global Health, how not to write about global health. And this is a piece of satire in which I make fun, in essence, of the non-equitable, the exploitative ways in which global health is still being practiced in ways that are very reminiscent of colonial medicine. This piece it doesn't follow the formula that we will share with you later on, but it's been the most impactful thing that I've written because I was able to tap into some creativity that I didn't know I had. And it has led to so many opportunities for me. I've given 25 plus talks to universities and institutions around the world on this topic. And this piece is included in dozens of global health curriculums, right? So it's used to teach global health in universities around the world, and op-eds can be used in this way as well, right? So the impact of the op-ed is really powerful if done well. But keep in mind, again, the point of me sharing this is about the impact, but also about the need for creativity when you're writing your op-ed. There's a formula, but you need to add your own special sauce to it. So why should you write an opinion piece? I think we've already touched on a few of this, right? Clearly, you have an opinion about something, an opinion about a topic, an opinion about an event that is making news or not making news in your community, but you want to share about it. It could be a policy that your government has passed that you agree with, or you don't agree with, or you think needs to be improved. So you share your opinion about it. Opinion pieces can also be written to inform the public, right? There's something that they should be aware of, a new finding in a study, right? Researchers tend to write opinion pieces to inform the public about a latest development in their research, right? Not as many as should, right? Because many researchers think that once the manuscript is published, that's the end of it, right? You're done, right? But most of the manuscripts that are written, just end up in scientific journals, and very few people read it. But if you publish an opinion piece, you're able to get your findings and the potential impact of that research to more people than if you just left it as a manuscript, right? So you can write your manuscript to inform the public on your research and other topics. You can also be written to persuade readers, to persuade the public on a particular topic. So the example of the Barbie movie, that Barbie op-ed that I shared, right? There's a lot of discussion around that, and quite a number of people are writing op-eds as to whether it's a feminist movie or it's not a feminist movie, or whether and so there's actually a discussion, and people are trying to persuade them and trying to persuade each other on their stance on this movie, right? So it can be written to persuade readers, not just on health issues, but on pop culture issues as well. There are different types of op-ed, different flavors of op-eds. Op-eds can be written, the op-eds that are written to explain or interpret, right? This could be similar to an op-ed that is written to emphasize the findings of a research, right? A research study. You're explaining the research study in simple terms for the audience, or to explain a policy. An example of this is, again, this is a very American example, but when Barack Obama was trying to pass the Obamacare Act, he wrote quite a number of op-eds trying to persuade the public about the benefits of this Obamacare insurance. The other reason why people can write op-eds is to criticize, right? So while Obama was writing his op-eds to persuade and explain, the Obamacare, there were those that were writing to criticize his policy that was about to pass. It can be written to persuade, right? Encourage readers to adopt new thoughts and new ideas. It can be written to praise, right? You can praise something that someone has done, something that has been published, an action by a politician, or an action by someone in your community. So I'm going to I'll keep going and then I'll pass it over to Ulrick. But the important thing to remember is that sometimes when people hear opinion, they think that an op-ed is just about an opinion, but it's not, right? It's not just about an opinion. It's not just you and your buddies sitting on a Saturday night and sharing opinions about this and that. And op-ed, it's an opinion that is informed, that is well thought out, and backed by evidence and very clear thinking. Right? So you give your opinion, but you have to your readers, right? So again, this is what an op-ed is. It's informed by logic, not emotion, not ideology. It's, even though it may be informed by your own experience, right? Emotion cannot just be the main driving force of your opinion piece. It's based on facts, research, evidence. It's written to educate and not preach, right? You don't want to preach about your particular view, to preach about your ideology to others. People don't like to read those types of articles, right? So you write to educate. It's colorful and fast moving, right? And I put provocative here. And what I mean by provocative is it has to be interesting. If you're writing an opinion piece that just says your opinion is that health is good, sure, you'll find few people that would disagree with that, but it's hardly an interesting opinion, right? So how do you write? You need to figure out a way to present that opinion. Otherwise, you lose your readers, especially in this day and age of social media, right? Within the first paragraph, first sentence, really, if you've not captivated me, you've lost me. And finally, they're not too academic, right? Not too academic. It can be academic. You have to present the facts. You have to present the evidence, but it has to be readable to the public, to somebody who is not an expert in your field. So I'll pass it over now to Ulrick to take us through how to actually write an op-ed.
Thanks, Des. I'm just noticing that there's a bit of connection issue there. Anytime you start losing me, let me know and I'll cut my video so you can keep hearing me. So it all starts with an idea. And we're talking about ideas here. I know it can be challenging for a lot of people to think to themselves, like, how do I come up with that idea? There are a number of ways you can come up with an idea. And in fact, we always come up with ideas, but we're going to try and give some structure to idea generation. So first things first, you are special in a lot of things. Your experiences are not the experiences of other people. And your experiences make you very special, particular, in the sense that you have lived certain things that other people haven't, right? So you believe in certain things that other people have, and you've got some expertise in certain things that other people haven't. And that alone is enough to get you to come up with an idea. Think about every time you saw something happen and you felt, I think that could be improved. I think that could be done differently. Or I like what was done there. That in itself, if you go back to what Desmond said, you can write an op-ed to criticize, you can write an op-ed to praise, you can write an op-ed for so many reasons, even just to bring about discussion. So the first thing you want to rely on is your experience, your belief and expertise. The next thing is you want to stay abreast. This is one of the most important things about op-ed. We'll hammer this point as we go through. It has to be timely. What is happening? What do people care about at that moment? We've all gone through it. We are hearing news after news after news through the day, through weeks, through months. And sometimes something that was so important a couple of weeks ago is no longer because there's something else that's taking precedence in the news. So you have to pay attention. So right now, I invite you already to start thinking, what are some of the things that you've been seeing around in the news, whether that's on social media, traditional news, and all those things. Then you want to stand on the shoulders of giants, essentially. Other people have written opinion pieces, and you've probably read them. So keep reading them. And when you see one that moves you in any way, maybe before you started reading the op-ed, you had a set, your mind was made up, and then this person almost moved you. You're like, oh, I get where this person is coming from. Or maybe you didn't even have an opinion, and after reading this person's piece, you're like, oh, I side with this person or not. Maybe I side against this person. So what is it about this opinion piece that got you to move either in their direction or against their direction? And learning from that is a very, very important tool at your disposal in terms of idea generation. Well, stay abreast also of the hard data, right? So the evidence. What are people in that space saying? It's one thing to say, I believe that universal health coverage, for example, should be available in every single country. But what, for example, does the economics say? What does the legal aspect say? What does the policy say? So stay abreast of that so that you're able to inform yourself. And the more recent information, obviously. The last one is bounce your ideas off people. We can never overemphasize this. Bounce your ideas as much as possible. Discuss with people. And maybe even you will get to see whether people are actually interested. Maybe when you start the conversation, people are not quite sure what that means. That means in your op-ed, you know what you need to do. You need to clarify. Maybe people are not so engaging into this. And so you need to find a way to get them engaged. So now let's think about it. So how do we put that op-ed out there? This goes back to one of the things we've said. Think about some of the op-eds you've read and that moved you. How were they written? Usually you would find some elements of this, maybe not all of them, but some elements of this. The recommendation here is when you're starting off, learn the rules. Learn the rules then so that you can break them and break them beautifully. You cannot break the rules when you don't know the rules. But this is where you want to start. You want to start usually with a hook. You want to hook people. And this goes by, I think it's Laurie that said short attention span. And it's not just in the US. When your op-ed gets published, when the links get shared, usually you only get those first few lines, and it's usually on social media. And people make their decision on whether they want to read it based on the title and based on those first few lines. So you need a hook. You need someone to care about it. So what can you say that will get people to care? Sometimes it's because there is a big news story, something that everybody cares about. Maybe when we're talking about the anthrax, there was some unfortunate events, someone that's well known in Nigeria that had the anthrax, or it was a young person or a protected population that had it. And so we want to work around that to get people to care enough that they will click and then read the op-ed. If they don't, then whatever we did was not helpful for them. So in the case of the anthrax in Nigeria specifically, let's try and find something that people care about. It's not just saying there's anthrax out there. Is it maybe a region of Nigeria that gets a lot of difficult events? Maybe this is one of those regions where they already had, I don't know, kidnappings and maybe Boko Haram and all those things, and now anthrax adds to it. Like, what's this? Or maybe it's a region from which one of the presidential candidates were hailing from, or something like that, or maybe one of the artists. So we want to get a hookup. You need to think about what your main argument is. What do you want people to understand? I know there's a lot you can discuss from something like anthrax. You can discuss economics, you can discuss policy, you can discuss specifically health policy, education, and all those things. But if you take too many things, the chances are people won't be able to follow you. You will lose them. So try and choose a single main argument and go ahead with that. So in this case, perhaps we're interested in how veterinary medicine should be coordinating with human medicine to manage these outbreaks. So maybe that's our point. What does the data out there suggest? You cannot just go out there and be like, I believe. Someone said, in God I trust, everyone else bring data, right? So you need to bring some actual evidence, hard facts that back what you're saying. And so you need to delve into the research and find a more recent research. You cannot just be criticizing. I don't know if we can emphasize this enough. You cannot just be going out there saying, so-and-so government has not been able to handle this, and this other person has not done this, and this other person has not done this, and this is bad, and this is bad. People don't want to read bad information all day long, because that's all that you find on social media and on TV. What are you suggesting? What is your solution? If you write a piece without suggesting a solution and you're only criticizing, you're not helping advance the conversation. Bring a solution. And the solution has to be really specific. Who do you want to do what, when, why? Think about what your con arguments would be, like the counter arguments. What would someone who does not agree with you think about what you're saying? And try to preempt. Say, I would expect that people who do not believe that there should be more coordination between, veterinary and human medicine may say that it's bringing an undue burden on the health system and it requires more funding that the state does not have, and those different things, because we have other problems. Maybe we have polio, like I saw before. Maybe we have polio around here. We need to care about that. We still haven't taken care of COVID and all those things. And you can preempt perhaps by saying, well, I understand that, but if this is left unchecked, it may become the next COVID pandemic. You see what we did there? We identify a counter argument, we state it clearly, and then we bring some elements in our defense, right? So that a point gets across. Before you close, once again, repeat the main argument and a call to action. We'll emphasize that again.